You know, March is Colorectal Awareness Month as far as diseases, specifically cancer. So Merit Health invited us to come over and talk to Dr. Mark Hopkins, who is a gastroenterologist for them here in Biloxi. How are you? Nice to meet you.
Very good, thank you.
Well, if you would first, before we get into talking about that, give us a little bit of background about yourself, if you would, please.
So originally I am from Pennsylvania. I went to medical school at Temple University up in Philadelphia. I joined the Air Force and I did my internal medicine residency right here at Keesler Air Force Base. I was in the hospital during Hurricane Katrina, so I have my hurricane experience.
Wow.
I then went to Washington, D.C. at Georgetown to do my gastroenterology fellowship. And then in 2009, the Air Force brought me back to Keesler to be the gastrointestinal staff doctor there for the last 7 years. I separated from the Air Force this past year, and that's whenever Merit brought me on to be staff here at their hospital. So for the past year and a half or so, I've been gastroenterology staff physician here at Merit Hospital.
Well, first of all, thank you so much for your service to the country.
You're welcome.
I know that Merit Health has worked a lot with different doctors from Keesler, and they've had a lot of them come over here because they're great. It's a great source for in the world of medicine. And as you said yourself, you know, you're here now. We're a doctor over there. Gastro Awareness Month. March is, but it's something that you don't wait till March to, maybe have yourself checked out or whatever. There are a lot of issues that people have to deal with. What do you see more of when it comes to gastro problems?
So here in the gastroenterology clinic, most community gastroenterologists like myself, we tend to have referrals for routine things like heartburn, constipation, diarrhea, difficulty swallowing, and then of course a big portion of our referrals are for colon cancer screening. And so that's what the March Colorectal Cancer Awareness Month is all about, is to get the word out and increase awareness of the importance of screening for colorectal cancer.
Okay, and of course, you know, when they go to their general physician, they, through regular examinations, can determine whether you need to go see, Dr. Hopkins, and if there's an issue there, then you can find out and get on it, sooner the better.
So yes, so from a screening standpoint, the guidelines recommend that we should all start screening at a certain age. And for most of us, the age is 50. For certain populations, such as the African American population, guidelines recommend to start screening at a younger age, between 40 and 45. Their risk of colon cancer is increased slightly, and it does tend to occur at a younger age. So the guidelines recommend to start screening them at a younger age. But for everyone else, the guidelines recommend to start screening at age 50. So most of the time, colorectal cancer screening is initiated by the primary care doctors, whether that's a nurse practitioner or a physician. Most of the time, that's part of their preventative medicine that they discuss with patients. But we also want patients themselves to simply be aware, because a lot of times primary doctors are very, very busy. They're managing different problems and different things that are going on. They may not have very much time to sit down and discuss these things. So we want the patients to also initiate that conversation with the primary doctors and say, hey, I'm 50 or I'm 55. I've heard about colon cancer screening. Is this something that I should get done?
Right.
And that's conversation is something that can be initiated through primary care, and then the primary care doctors would then refer those patients to gastroenterology if they would do in fact need a colonoscopy for screening.
Now, are there symptoms that someone may have that they might think, I might need to go get checked?
So the answer is no. Typically polyps and colon cancer do not cause symptoms until the colon cancer is very late, in which case it could cause bleeding. And that's one of the reasons that we do want to get the word out to increase awareness, because we feel it's very important for patients to understand that you can't just simply wait until there's a problem. By then it's too late. This is asymptomatic screening, so these patients need to come in and be screened regardless of what their symptoms are. Now, I don't want people to be confused and think that they don't have to get a colonoscopy until they're 50. If you start having bleeding or bloody diarrhea younger than 50, we're no longer talking about a screening colonoscopy. We're now talking about a diagnostic colonoscopy to figure out what is wrong. Right. So if patients who are in their 20s and 30s are having blood in their stool, it's very important that they talk to their doctor about that and seek a referral to gastroenterology to get a colonoscopy done.
Is colon cancer hereditary?
That is the most
I know.
important factor.
I know. You know, you hear about breast cancer and all that. It could be, but you know, is colon cancer?
So family history is probably the most important factor when it comes to risk of colon cancer. Other things being smoking, possibly diet high in red meat and low in fiber, but certainly family history is the most important, and those patients who do have a family history of colon cancer actually need to have their screening done sooner. So they should not wait until they're 50, but that's something that's very important that they discuss with their primary care doctors, because typically screening would start at age 40 or even younger sometimes if patients have a family history of colon cancer.
Is the South a region that might be higher in colon cancer cases than maybe other regions around the United States?
So the risk of colon cancer is similar in the South to the rest of the country, but the problem that we have here in Mississippi is that our screening rates and our ability to treat colon cancer tends to be lagging compared to other states throughout the nation. So that's one of the reasons that here in this clinic, myself and the colorectal surgeons, Dr. Tyler and Dr. Brown, we want to increase awareness because we want to improve our screening rates here in Mississippi, and we want to improve our ability to treat colon cancer once it's found.
Now, you have a little graph here of the digestive system and everything. So, you know, you have, you know, here you have the colon. What other other problems can people deal with here? We got about a minute and a half left.
So this is the colon, the large intestine, and that's what we look at when we perform a colonoscopy. We don't go into the small intestine because we don't have a scope that's long enough. But when we do a colonoscopy, we're primarily looking for polyps. That is the precursor to colon cancer. It doesn't turn into colon cancer overnight. It takes many years for that to happen, so that means that we have a big window of opportunity to find these polyps in the colon and remove them to reduce the risk of colon cancer. Now, we can't prevent colon cancer completely because nothing in life is perfect, but studies have shown that we can reduce the risk of colon cancer with a colonoscopy.
And the outcome of you know, if you find it, taking care of it, and you know, hopefully everything works out fine.
Yeah, so the colonoscopy is a very simple, quick, easy, safe procedure.
You sleep real good when you're having one.
And you have a good nap, and then you wake up and you're all done. So.
That's right. Well, Dr. Hopkins, thank you so much for the information on that. Again, if you're in that group, the age group that we were talking about, over the age of 40, 45, for African Americans, or, you know, 50, beyond that, talk to your regular practitioner and get them to, you know, make an appointment for you or give you a prescription, so to speak. Come see Dr. Hopkins if you need to. Be on the safe side. That's something, the most important thing, you know, not only thinking of yourself, but thinking of your loved ones as well.